Age-related macular degeneration, or AMD, affects the macula, or the central part of the retina. This is the part of the eye that allows you to see fine detail. It can cause the sharp central part of your vision, which we need for identifying people's faces and straight-ahead activities like reading, sewing, and driving, to become blurry or wavy. In some people, AMD advances so slowly that vision loss does not occur for a long time. In others, it progresses faster and may lead to a loss of vision in one or both eyes. As AMD progresses, the blurred area may grow larger or may develop blind spots in your central vision. AMD by itself does not lead to complete blindness. However, the loss of central vision in AMD can interfere with simple everyday activities, such as the ability to see faces, drive, read, write, or do close-up work, such as cooking or fixing things around the house. Dry AMD is the most common type of this disorder, which can lead to the wet form of AMD. It can cause gradual breakdown of the cells that make up the macula. Dry AMD is characterized by the gradual buildup of clumps of waste products located under the retina. These waste products cause a gradual increase in stress on the macula cells, which eventually causes them to die off. Wet AMD causes the most serious vision loss. In this form of AMD, new abnormal blood vessels start to grow under the retina. Unlike normal blood vessels, wet AMD blood vessels are fragile and leaky and can break easily. As the blood vessels leak or bleed, the retina becomes swollen, causing a decline or loss of vision. If not treated, vision loss can progress. AMD is a leading cause of vision loss for Americans aged 65 and older. Risk factors include race, more common in Caucasian populations, smoking, obesity, gender, women are more likely to have AMD than men, and family history. Some researchers have found links between AMD and some lifestyle choices, such as smoking. Some recommendations for reducing your risk of AMD or slowing its progression involve avoid smoking, exercise regularly, maintain normal blood pressure and cholesterol levels, eat a healthy diet rich in green, leafy vegetables and fish. Most importantly, vision loss can be prevented by visiting your eye doctor regularly and learning to watch for the signs of AMD and taking care of yourself. Symptoms for AMD include blurry central vision, straight lines may appear wavy like telephone poles, sides of buildings, dark or empty spots in the center of vision. Patients with AMD are often asked to monitor their vision at home, and they're given a piece of graph paper with lines, which is called an Amsler grid, and asked to look at it one eye at a time individually. The purpose of this is to pick up on changes that are occurring in the retina in between doctor visits that maybe they wouldn't pick up on during just daily tasks because both eyes are open and it's sharp and they won't notice a problem. The Amsler grid is depicted on the slide. It's that grid in the kind of bottom right of the slide. People with wet AMD are treated with injections of medications which are given quite frequently, often monthly, and multiple injections are usually given to control the blood vessels. There are also special laser treatments called photodynamic therapy that remove the blood vessels under the retina, as well as laser surgery. People with dry AMD are typically advised to take ARED supplements, which have been shown to reduce the progression of the disease. ARED supplements refer to the Age-Related Eye Disease Study, which was sponsored by the federal government's National Eye Institute. They found that taking high levels of antioxidants and zinc can reduce the risk of developing advanced AMD by about 25%. The ARED study was a major clinical trial that closely followed about 3,600 participants with varying stages of AMD. The results showed that the ARED's formulation, while not a cure for AMD, may play a key role in helping people at high risk for developing advanced AMD keep their remaining vision.
Vision is such an essential part of our lives. So much of what we do and enjoy depends upon the ability to see clearly. So if your vision begins to fail, it can cause great anxiety. But if you understand what is happening with your vision, you gain a sense of control over the situation, providing some peace of mind. One of the leading causes of vision loss in people over 65 is a condition called age-related macular degeneration, also known as AMD. To understand how AMD affects your vision, it's important to understand how the eye works.
Light rays enter the eye through the cornea, pupil, and lens. These light rays are focused on the retina, a light-sensitive tissue lining the back of the eye. The retina has two areas, the peripheral retina and the macula. The macula is a small area at the center of the retina. The peripheral retina is the large area surrounding the macula. It is the peripheral retina that gives us our side or wide-angle vision. It is the macula that gives us our pinpoint vision and allows us to see details clearly, helping us to do things like drive, read, or recognize a face. Age-related macular degeneration, or AMD, is a breakdown of the macula. When the macula doesn't work properly, your central vision can be affected by blurriness, dark areas, or distortion. This condition affects many people as they get older.
There are two forms of AMD. One is called atrophic, or dry form. The other is called exudative, or wet form. About 90% of patients who get AMD have the dry form.
The retina is made up of many layers that are sandwiched together into a smooth surface. These layers work together, allowing us to see clearly. In people with dry AMD, the layer under the retina, known as the retinal pigment epithelium, or RPE, is affected by deposits, called drusen, as well as other age-related changes. These changes may cause vision to deteriorate.
A basic yet important tool for monitoring your vision is called an Amsler grid. You can use it at home to detect changes in your central or macular field of vision. You simply sit in a well-lit area and hold the grid away from you at a comfortable position. If you wear glasses, you should keep them on. Cover one eye and look directly at the point in the center of the grid, but observe the pattern of vertical and horizontal lines in your peripheral vision. Then do the same with the other eye. Typically, a visual abnormality due to AMD would cause some of the straight lines to appear wavy or blurry, or areas to appear dark or even blank. If you notice any new changes in the grid, you should contact your ophthalmologist immediately. If a person with dry AMD notices changes when they use the Amsler grid, this can be a sign that wet AMD is developing.
With wet AMD, abnormal blood vessels begin to grow under the retinal layers behind the macula. These blood vessels leak fluid or bleed, which further blurs or distorts central vision. About 10% of people with macular degeneration have the wet form.
If your ophthalmologist suspects macular degeneration, diagnostic techniques such as fluorescein angiography and optical coherence tomography, or OCT, are used to help identify what's going on with the macula. Macular degeneration is a very common vision problem. While we do not know how to prevent or cure this condition, we are learning more about it. Researchers are continually evaluating new forms of medical, surgical, and laser treatments. With early detection, we can often help slow down visual loss and preserve sight. And with our newer treatments, in certain cases, vision can even improve. If you have AMD, understanding your condition and being vigilant about monitoring your vision can help you successfully maintain your quality of life.